Welcome to COVID313 Coalition for Families and Students Town Hall. We are so excited to be here with you for another week. I'm Christine Bell. I'm honored to serve as the Executive Director of Urban Neighborhood Initiatives, and I'm a proud member of this coalition. And most importantly, I'm a mom of 3 awesome young children. And not only do I really enjoy moderating this town hall, but I learn a lot while I am doing the moderation. We are translating the town hall to ASL. We are waiting for our interpreters to get on. And so while we're waiting, we just want to remind everyone that this is a two-way conversation. So we want to hear from you. We want your questions. You can put your comments or questions in the Facebook chat, and we have Brooke and Amy that are waiting there to hear from you. And let's see if they are on top of their game today. And why don't you just drop in the chat where you're joining us today, and how did you hear about us? Have you been watching the town hall all along since we started back in March of 2020, or is this your first time here? And Brooke and Amy, keep a lookout. So while we continue to wait for ASL, we want to remind you to stay with us for the next 60 minutes so you can stay informed and be empowered. We have a collection of experts to share their important knowledge in a variety of areas and answer some common questions that many of us are asking right now around a variety of topics. And again, this time, we also want to hear from you, and it's a time for you to ask these experts your questions. So again, to ask your questions, you can drop them into the Facebook chat. We've got folks there waiting for you, Brooke and Amy, and we'll have a question and answer session after most segments. If we can't answer your question today, we're committed to getting you the answers by early next week. All the questions asked today will be posted with answers on onedetroitpbs.org. And now I have the pleasure to introduce Brian Love, who is a long-time education advocate. He's a father of 2 and a board member at Detroit Parent Network. He is also a COVID survivor, and and we'll be talking today about his journey after his COVID diagnosis. And I feel very honored that I get it to introduce you because Jametta is not here today. And so I hope I did that justice. And I also feel like I should know you and because of all of the really wonderful things that many folks that are part of this coalition have said about you. So Brian Love, welcome to the COVID313 Town Hall, and I am going to let you take it away.
Thank you, Christine. So we know each other now, and so moving forward, we'll get to know each other even better. Hello to all of you, particularly all my friends on this call. I didn't realize I had so many friends on this call. Just to get right to it, a number of folks know that, or a lot of folks didn't know that I had COVID. I mean, that's the way COVID kind of works, right? You know, when you're sick, you can't really talk, so you can't tell people that you're sick. So my family, my household, and I became sick with COVID. March 13th, 2020, literally when the state was just hitting the state, and we were all just figuring out what it was. My wife and kids and I, we were all virtually diagnosed with different things, mostly bronchitis or me with severe flu, although I had the flu 2 months prior. So everybody was still trying to figure out what it was, but literally, although my household, we went through this together, we still went through it separately. We didn't know what to do, so we were all literally in our own rooms for a number of weeks. Fortunately, my wife and kids, they were able to get better and heal after a few weeks. For me, it took a few months before I was COVID negative. And still today, even after becoming COVID negative last July, I still have some side effects that still bother me. to this day that I'm working very aggressively to get through because I plan on being around for a while. But I can tell you, I also learned some very special things that I don't think I would have appreciated before COVID, but I appreciate now. So I would just say that it's been last year, 2020 was a rough year. 2021 has probably started off a rough year, but it's been rough for all of us. So this is the one time I think in our entire planet that everybody can say we all had a rough year and we all had a rough year together. So I think figuring out how we do it, get through this together is how we actually really try to survive. Speaking of survival, so some of my effects, COVID affected me by, I didn't go to the hospital because at the time it was early in the pandemic and I could breathe, but I didn't realize that I was struggling to breathe at the time. I had major flu-like symptoms. It's hard for me to really talk, hard for me to really move. My mother, who had it at the same time, although we only lived like a 5-minute drive away from each other, we couldn't see each other, could barely talk. Luckily, she wasn't as severely affected as me, but my mother would call me every day. And if just to hear me grunt and moan and say something, then that's kind of what kept us going day in, day out. I've never been separated from my family the way I was, although we were in the same house. We were literally in separate rooms. My son, who was the last one to catch COVID, actually caught it because he actually had to take care of all of us. And so we really struggled with that. I still struggle with the fact that my son got sick because he had to take care of me and the family. He did the shopping. He went to Walmart. He was the guy who, if somebody was fighting over a case of water, he needed to get that last case of water to bring it home to his family. He made sure we ate. He made sure we took our medication. And then eventually he got sick. Luckily and fortunately, he recovered actually quicker than the rest of us, which was a blessing. So definitely have learned a lot through this process. I've learned to respect that, our health is important. I know a lot of folks lost a lot of people last year, but we've all lost a lot of people this last year. One of the things that stands out for me is, in our community especially, a lot of folks have already had pre-existing conditions. COVID tends to make it 10 times worse. And so it really is, I really, anytime I get a chance, I tell folks, one, get your vaccine. Anytime I talk to and also care for your health. Men of color, we tend not to take healthcare as seriously as others. We need to, and we need to be able to feel fortunate to talk about it. So I don't have a problem talking to people about my health. Before this, I probably never would have. But I lost a lot of friends last year, and I don't want to go through another year like this again. I spent 4 years in the Marines, deployed overseas. They don't train you to deal with losing family and friends. So anytime I could be a help to anyone to improve their health care, you can sign me up. I'm there. Come pull me on out, Christine.
All right. So I think it has been a really difficult year, and so there's just been a lot of sorrow, and some opportunity, right? So like what you just said, Brian, about recognizing how important it is to care for your health and to take that time. I hope that resonates with the folks that are listening, because it is so important. Could you just in 30 seconds, I know that you got the vaccine, even though you experienced COVID. Can you just share in 30 seconds why you got vaccinated?
Like I ended, I don't want to, I have parents who are both in their 70s, and they, if I want to spend time with them, I need to be vaccinated so I can make it safe for them and for me. And, I just, I'm one of about 8 brothers and sisters. And I actually have 1 or 2 brothers, and they probably hate that I mentioned this, but I won't say their name, but 1 or 2 brothers that really don't want to take the vaccine. I said, that's too bad because I love you, but I don't plan on seeing you, and I'm vaccinated. I'd rather get vaccinated. When I took my vaccine, I probably had some kind of rough side symptoms, but it compares to nothing like being sick with COVID. I'd rather go through 4 shots of Moderna than going through 1 day of COVID. And that's just real talk. That's just real talk. And I get all the conspiracy theories. I get all that. But it's easy to say that and you've not had COVID. You had COVID one time, just one time. I think you'll be clear.
Well, Brian, I'm just going to echo what's been put in the chat of we are so appreciative of you sharing your story and quite frankly, being vulnerable. And we wish you continued healing as you continue to work through the long-term effects. And thank you for providing a little inspiration today and a reminder of how serious this is. So thank you so much, Brian. We appreciate you. And we're really lucky that you're here to tell this story. So thank you.
Thank you, Christine. Thank you for allowing me to turn into a big crybaby today. That is a very rare occasion. So good job. Good job.
Well, you also made me cry. So I just, we just had a colleague lose someone to COVID yesterday. And, it's this reminder that it's not over and that we have work to do. So thank you.
Thank you. I'll just leave with, you just said my mother's favorite saying since this happened and she got over COVID. We do a family Zoom call every Sunday. And she says at the end, it ain't over. It ain't over.
It ain't over. That's true. Thanks, Brian. All right. Well, I feel like Brian has made a wonderful segue into introducing our representative from the Detroit Health Department. So Tanya, if you will please join us on the screen.
Hello.
How are you?
Hello, pretty good.
Hi.
How are you? Hello.
Good. So like always, the health department comes prepared, and we come prepared with some questions, but we'll let you take it away, Tanya, and then I will be back on to ask you some questions.
All right. Thank you, Ms. Bell. Hello, everyone. And of course, we like to start off with data. That's the most important thing, is to be able to see numbers. So if we're just going to go over some numbers on the next slide, and this is just a quick overview of where we are right now. Right now, the COVID-19 vaccination rates, and these numbers at the top here are the city of Detroit being fully vaccinated. And right now our number has gone up a little bit, 37.4, and that's still low. But if we look at Macomb, Oakland, the outer Wayne, and Washtenaw, we're at 50s, just about 55 and up, almost at 70%. Those numbers are really good for the other ones, but the city of Detroit, we really need to strive and encourage those that are not vaccinated to get vaccinated. The whole state of Michigan right now is between 56 and 63% vaccinated. And that's why we're going to talk about our new initiative from our governor, who took off some of our restrictions, and we'll talk about that. If we can go to the next slide, we'll talk about some side effects of receiving a vaccine. A little bit of pain at the injection site, some tiredness, maybe a headache, maybe muscle and joint pain, chills, nausea, maybe some vomiting. That's not usual, but maybe a fever. But like the young man just said, I'd rather have these. Matter of fact, let me try to say it like he did. 3 Modernas is better than having COVID. So if we think about the side effects, because that's the question that we get very often, if I get this vaccine, am I going to be sick? You may have side effects. It's not promised. But if you get COVID, you're risking being severely ill or maybe passing. I think I'll be like our witness and say, I would rather get 3 Moderna vaccines. And if we can go to the next slide, please. And we always like to bring up what are our myths. We constantly want to educate that there are no DNA changes, there's no live COVID, there's no magnetizing, there's no shedding. We can go through all of, the myths. There's no microchips. And to encourage, what the Detroit Health Department is encouraging is that you call us, because we have a number set up where we can talk one-on-one. And that's most important for listening, for getting the right facts, for us being able to be available to give education to the city of Detroit. We have a nurses line, and we're available Monday through Friday from 8 a.m. to 6 p.m. And that number is 313-876-4600. And you press 3 and you're going to get a nurse. And again, we can talk. There's no dumb questions. But if you have questions about the vaccine, it's important. Why not get an answer? We're available. So if we go to the next slide, we're going to talk about the 3 vaccines that are available, the Pfizer and Moderna. Both of those are mRNA vaccines. They're both in 2 doses. The efficiency for both of those are 95%. What does that mean? You may have a 5% chance of catching COVID after receiving that. Full protection achieved after 14 days after your second dose. What does that mean? That means you're fully vaccinated after 14 days after your second dose. But guess what? All 3 of them are 100% effective at preventing you from being severely ill and death from COVID. As a healthcare professional, that's what we want to prevent, is from seeing people be severely ill and losing people, because we have already lost way too many people. Johnson & Johnson is a one and done. That's what we call that in the healthcare profession. After your 14 days, you're fully vaccinated. So what we're going to do now is talk about, if we go to the next slide, we're going to talk about some of these restrictions. So we know that Governor Whitmore gave us until July 1st to come up with, she was going to change the restrictions. But because Detroit right now is about 63% of being fully vaccinated, and her goal was 70%, but as of June 10th, we hit 60%. So we've gotten closer. So she decided to change some things. So as far as masks, we're going to look at what we can do and what we can't do. So beginning June 22nd, there are no longer a statewide requirement to wear a mask in most settings. Restrictions are lifted. However, the local health department asks that you wear masks no matter if you're vaccinated or unvaccinated in establishments, sports organizations, outdoor, indoor. There are requirements for schools to still wear masks. We have to be mindful that our children 11 and under are not able to get vaccinated as of right now. The schools may have some additional requirements for 12 and up college, but we have to go according to their guidelines. The CDC is still requires masks for public transportation, such as buses, trains, and airplanes, as well as airports. That's generally putting the information as far as wearing a mask. So when we talk about that, we can, if you have any other questions, and I put it in a list in the overall topic. If we go to the next slide, and this is a general here, and it's hard to understand, but this right here is a list of what Governor Whitmore has said we basically don't need anymore. So when we talk about gatherings and face mask orders, that has changed. Basically what I just mentioned, the temporary restrictions for entry and congregate facilities, the mandatory testing for Michigan Department of Health, most of these are being tested continuously. When you're in contact sports, when you're going to work, safe housing for Michigan homeless, a lot of times these people, not even a lot of times, it was a requirement to test at least once or twice, sometimes 3 times a week in order to resume work. So she has taken those and said, you know, it's up to the facility now. I'm no longer requiring it, but if the facility does, because we have to be careful of MIOSHA, that if they require it, if they require you to wear a mask, that's totally up to them. And that's safety for everyone. So if we go to the next slide, and this just talks about who's eligible. Anyone 12 and over is eligible for a vaccine, for a COVID vaccine. You just call that number 313-230-0505. And if we go to the next slide, we'll talk about our new, well, even better than that, one more. Go talk about our new Homebound program. And for this, you can also dial that number, 313-230-0505. And the Detroit Health Department will contact homebound residents, or you can call to get someone to come out to your home to vaccinate you. Again, the next couple of slides is just our contact information, and we'd love to leave that. And that also talks about the Good Neighbor program. Anyone you take to get vaccinated, the mayor has said you can register as a good neighbor and receive $50.
Wow.
Sounds like a good plan to me. You can take up to 3 people at one time. And he said, basically, you can run that all day long, except if you make over $600 per day, then they're going to take taxes out. But if you're not doing anything, you can do that. If you need information, call us at the Detroit Health Department at 313-876-4600. I'm sorry, 4,000, 876-4000. Gave us a new number.
Yeah.
Option 3. And get a hold of us. We're here. We want to answer questions, any questions whatsoever.
So Tanya, I think the one thing before we go on to the doctors, because we have to move on to the next segment, is you shared what the state has lifted. What are there restrictions still in Detroit, and what are they, if there are?
So as we look at the numbers for Detroit, because thank you, Ms. Bell, for asking that question, because that's a number one question for the city of Detroit. So right now, as of June 23rd, Detroit is positive rate has gone down tremendously to 1.5%. Yay, that's wonderful. But as we look at only 37% of Detroit being vaccinated, we want to be mindful of wearing masks, social distancing, and things like that, because we have to know in our surroundings that there's a lot of unvaccinated people. So not right now, the city of Detroit, there's no mandate in wearing masks, but the city of Detroit is asking to wear a mask if you're around people. If you're outside, it's okay. But if you're in a large gathering, wear a mask, because you don't know who you're around. Unvaccinated people or low compromised immune systems. So wear masks, social distance, continue to use hand hygiene. That's we're going to continue to push that.
So while there's not restrictions, the health department is still encouraging folks to wear masks and to social distance and maintain your I was going to say hair hygiene, sorry, hand hygiene. And your hair and hand hygiene, and there are opportunities to be vaccinated. You got all the information. Tanya, we'll see you next week. Thank you so much. And I am kicking it off to Rajeshri. Rajeshri, welcome. So glad to have you as my co-moderator, and take it away.
Thank you, Christine. And thank you for all the wonderful information that we just heard. It's my pleasure to welcome two esteemed physicians. So if I could ask Dr. Dennis Cunningham, who's Assistant Medical Director of Infection Prevention for Henry Ford Hospital System, and Dr. Linda Nabha, who is an infectious disease expert, to join me. Good afternoon, both of you. Welcome to the COVID313 Town Hall.
Thank you.
I have a ton of questions for you, so I'm going to just go ahead and jump in. Some of these will be for both of you, and some of them I'll direct towards each of you. So I'm going to start off for both of you. As physicians, are you comfortable taking your masks off in public?
I am. I was on vacation up north. I did not wear a mask at all. The people I was staying with, all of us were vaccinated, so I feel very comfortable. These vaccines are pretty good, and I take a lot of comfort knowing that my kids and my wife are also vaccinated.
Great. How about you, Dr. Nabha?
I think it depends for me. I have 2 young children. And so when I take them to the grocery store, they're wearing masks, and I'm in solidarity with them. I'm wearing my mask also. I think it really depends on where you are. If you're in a place where you're outside and the vaccination rates are high, I feel pretty comfortable taking off my mask. But in certain areas where I just don't know, I keep my mask on. I have immunocompromised family members, and my children haven't been vaccinated, so I still have that mask on at sometimes.
Yeah, I appreciate both of your candor in that question. And I think that's I think something all of us can relate to, is that it depends, right? Depending on our family situation and where we are. As the mom of an 8-month-old who also is somewhat immunocompromised, I'm in the same boat as you, Dr. Napa. But if she weren't where she isn't, then I might be more in Dr. Cunningham's boat. It's not that I don't have faith in the vaccines. It's again just that, you know, risk analysis based on each of our own situations. So thank you for being so open and honest about that. Question for you, Dr. Napa. When we talk about infectious disease and COVID specifically, how long does natural immunity last? So in other words, we heard from Brian Love, who talked about having COVID and still getting the vaccine. So the question I would have is, how long does that natural immunity last? And why is it important for people who had COVID to get the vaccine, or is it?
Yeah, so number one, if you've had COVID, the recommendation is still to get the vaccine. Now, the CDC has changed the recommendations. They used to say wait 90 days after you've had COVID to get the vaccine. Now the recommendations are get it when you feel better, essentially, at least 10 days after your symptoms have resolved. The reason for that is that we still are trying to understand what that natural immunity means. What does it mean to have COVID and to recover? How long does that protection last for? We suspect it probably lasts for at least 3 months. But, you know, there's lots of little places where there's data out there that tells us it's 3 months, 6 months. Really, we just don't know. And the safest thing is to vaccinate, even if you've had COVID.
Okay, great. That's really helpful. Dr. Cunningham, anything to add to that?
No, I agree completely. I think the vaccine gives probably better protection and longer protection. At least the preliminary data is very favorable for that.
Okay, great. And so Dr. Cunningham, can you talk a little bit about how this Delta variant is impacting communities with low vaccination rates like Detroit, as we just heard?
Sure. So the Delta variant, what's unique about it, it's the first time two separate mutations that are already out there have combined into one virus. So this may be another strain that's very easily transmitted. There's not a lot of data on it yet, but it certainly looks like it's very easy to spread. Right now, about 20% of all the infection in the United States right now are this Delta variant. The good news is the vaccines do look very effective. Pfizer's about 95% effective. It's 88% for the Delta variant. So the vaccines are really making me feel good, but it's very possible we're going to see more surges. Hopefully they won't be quite as bad, but if we have pockets of unvaccinated people, I would not be surprised to see increasing number of COVID cases.
So to that end, this morning I had a conversation with a number of school leaders, and we were talking about the differences between the vaccination rates and what's happening in Detroit versus what's happening outside in other parts of the city, as the health department just talked about. And so question came up is, do we need to behave differently in areas with low vaccination rates versus high? And what happens as we have sort of our borders are open, right? They're porous borders. So you've got kids that live in Detroit, for example, going to school or people going to work in other areas and vice versa. So, you know, for either of you, is there anything we need to do differently as we cross into areas that may have lower or higher vaccination rates?
I think if you're fully vaccinated, I think you're fully vaccinated, we're talking about the Delta variant, you can feel safe that you're likely very much protected. But at the end of the day, it's all about mitigating your risk, right? So if you are someone who has family members who are immunocompromised, or you yourself have been vaccinated and you're immunocompromised, or your children, young children, it's all about reducing your risk. So if you're in an area of the state where the vaccination rates are higher, you can feel a little bit more safe about that. But I think at the end of the day, I mean, we're playing with some numbers of 10 to 15%. I think it's all about risk at the end of the day. How much risk are you going to take in terms of exposure? But if you've been fully vaccinated, you have a normal immune system, quote unquote, I think it's safe to be able to not worry about the different numbers in the different counties in Michigan.
Looks like Dr. Cunningham is agreeing. So Dr. Cunningham, as we talked about, I was talking to some school leaders today, so our conversation was focused on the students and the kids. And is there any reason for us to be concerned in the fall, for example? And I'm talking about unvaccinated kids, so at this point, younger children. Is there anything that we need to be concerned about as we get them back together in the fall? And some of them would be coming from, homes or areas that are unvaccinated versus vaccinated. Is there anything what's your prediction of what we can expect?
Well, we know schools are a good place for different infections to be shared quite easily. And even if not all kids are going to get very sick from COVID, a small number will. But I worry more about them bringing it home to mom or dad or grandma or grandpa or other family members who might not be vaccinated, who might not have a good immune system for various reasons. So I think we have to keep close attention to what the numbers are in the fall to see, do we still need to have masks worn in school? Mm-hmm. And, there are areas of the states with higher vaccination percentages, but the magic number really, if you want to get these viruses under control, seems to be 70% fully vaccinated, at least based on the Israel studies. And there's very few counties in Michigan that are that high, and most of them, I know Leelanau County is very highly vaccinated, but they have a whole surge of visitors this time of year. So I really don't think any place is quite ready to yet say we're not going to worry about it based on our rates.
Yeah. Well, would you recommend that schools sort of plan for masks and it's a happy surprise if we're not able to do it? Or, are we at that point?
If we're not going to have a whole lot more vaccination by people in the state, I think masks might be a very reasonable situation, especially the older kids. I get it, for younger kids, it's very difficult, but There's also some advantages to wearing the mask so much. I don't know when the last time I had a cold was. I haven't had the flu in many years because of the vaccine. So I've actually enjoyed not having any colds or anything. So when respiratory season comes up, even though I'm vaccinated, I might still choose to wear a mask in the grocery store or on large gatherings.
Mhm.
To add on to what Dr. Cunningham is saying, our flu rates this year in this country have been historically quite low. We've seen a reduction in respiratory viruses in general, just simply by wearing a mask.
Okay, so masks have their advantages, right?
Yeah,
Little
I
less.
think this past year, there were only 3 laboratory confirmed flu cases in the entire state. And it's not because people are testing less. I can tell you at Henry Ford, when we test for COVID, the test also includes influenza. So we're just not seeing it.
Yeah, so there's definitely some advantages. I have appreciated the lack of runny noses myself in our home, so I can attest to that. So the other, another question that kind of has come up is with respect to, the vaccine. So if you are vaccinated and you get COVID, how does that impact you differently? And can you still get and spread it asymptomatically if you're vaccinated? Dr. Nabha, I don't know if you can offer some insights on that.
Sure, absolutely. So right now, the CDC recommends that if you've been exposed and you've been fully vaccinated, and that was outlined earlier, right? So you're at least 2 weeks post your second mRNA vaccine, if it's Moderna or Pfizer, or 2 weeks after your J&J vaccine, you are fully immunized, you're fully protected. So therefore, the recommendation is you don't have to quarantine. Now, could you asymptomatically spread that virus to someone else? It's highly unlikely. Is it possible? The answer is always going to be, we can't say this is ever going to be 100%, but we can say that we know that even individuals who were exposed, that they are highly unlikely to spread it over, who've been fully immunized, highly unlikely to spread it to other people.
Okay. Okay, so that's good to know. That gives a little comfort, as those of us here there. Dr. Cunningham, earlier you talked about 70% in the Israel study. Can you talk a little bit about how we came up with that 70% number, and what happens when that number is reached, and what happens when it's not reached?
Sure. So Israel was very aggressive getting their COVID vaccines out. They would vaccinate anybody. You show up, they didn't care what your race, religion, age, they just vaccinated people. And it turns out when they got to about 55 to 60% of the population fully vaccinated, they had a massive reduction in the number of new cases. When they got to 70%, it went even lower. So it may be that the herd immunity is 70% for COVID in populations. Now, herd immunity means there's enough people who are vaccinated that if a virus or infection comes into that community, transmission will not keep going on because there's so many people who are vaccinated. That number varies from virus to virus, bacteria to bacteria. But if we could get to 70% of the state fully vaccinated, I think we make the chance of future surges super, super low, and any surges are likely to be much less severe in comparison to the hell we've been through with these 3 major surges we've had in the past 18 months.
To add on to that, I mean, comparatively, it really depends on how contagious that illness is, as Dr. Cunningham said. For example, when you think of other really infectious contagious illnesses like measles, that number is very different. It's not 70%, it's in the 90s. So you really need to get into the 90% to get that herd immunity. So it depends on what that infection is.
Okay, but for COVID, it looks like 70% seems to be our magic number, which our transmission starts to die down. And then would it also be safe to say that we would see fewer variants at that point because there's just fewer places for the virus to be?
Right. The less, I'm sorry, the more you have replication, the more spike in the number of cases, the more mutations you're going to find. So it's really kind of a race, so to speak, to be able to get to that number or in or around that number before the virus mutates into something that won't be it mutates so a vaccine won't be as effective.
Great. And Dr. Napa, one of the things you and I talked about early on, and and I just wanted to share it with the audience and ask you to talk a little bit about your work with telemedicine and just kind of how you are bringing infectious disease care to populations that are unable to where they're underserved. So can you just spend 30 seconds, 90 seconds on what that is and how you're doing that and how that could potentially impact some of our community members in Detroit?
Absolutely. So I am an infectious disease specialist. I practice out of the University of Pittsburgh Medical Center, but I live in Southeastern Michigan. And I can do that because I am a telemedicine infectious disease specialist. What that is telemedicine is essentially a way for medical providers to communicate with individuals. And that can be via a virtual platform like we're doing today on Zoom, Doximity, or even telephonic consults. And so in many parts of the country, there's a huge shortage of infectious disease doctors. They're really in areas of major cities like New York City, Detroit, Washington, D.C., but in suburban areas or in rural areas, you don't find a lot of infectious disease specialists. It's always been important, but now in the age of COVID, it's become even more significantly important. And what we're doing through the University of Pittsburgh Medical Center is we're able to provide care, infectious disease care in these hospitals. We're set up on these TV platforms. We're going in and seeing patients. We've got nurses there. We use stethoscopes that are Bluetooth that we can listen to people's heart and lungs. What that does is we're helping the primary team treat and manage infections. We're treating the patients for infectious diseases, and we're allowing the patient to stay in that hospital. So they don't necessarily have to be transferred to a tertiary care center, for example, away from their loved ones, away from their home. They can get their treatment in-house in that hospital. And we are exponentially growing actually in this field.
That's so fascinating that basically electronically you're able to partner with the physicians that are on site to provide the care. And just the idea of a Bluetooth stethoscope is, seems like something out of some kind of sci-fi movie. Makes me wonder what else we were going to be able to do wirelessly or digitally. So thank you for sharing that. It's something that as our group, as we've been doing these town halls, part of why we do them is to help bring information to communities where information is scarce. And we know that medical care is not equally distributed, particularly in our community. So knowing that there are options like this might help some of our audience potentially utilize the service like that to help themselves. So thank you for sharing that.
Of course.
Dr. Cunningham, I would be remiss if I did not ask my daughter's question that I feel like she asks me every week. When will there be a vaccine? How close are we to getting a vaccine for the younger kids? And and also if you could speak to how the vaccine has been working and received by, the kids that have already gotten it.
So the children who have received it, it seems to be tolerated very well. Again, you may have some side effects afterwards, but they're very brief. It beats the heck out of getting COVID. Henry Ford actually had a webinar for our employees, and I had my kids join me. Tisha Johnson Hooper, the chair of pediatrics, her daughter joined as well. And we wanted to let the teenagers talk about it and how well it's been doing. So I think that's great. There are ongoing studies right now for both Pfizer and Moderna looking at the vaccine's safety and efficacy in people under 12 years of age. If I was in Vegas, I would bet towards the end of summer, early fall, we'll have approval of some sort for these younger people who would certainly benefit from it.
Great. Well, she will be happy to hear that. I will share that with her, and I think that as parents, we're happy to hear that there's some help on the way for our younger ones.
And that could really make their school year a whole lot better. The last thing I want to see are outbreaks that close schools or that they have to go to virtual platforms, because we know the social isolation has had a big impact on eating disorders, depression, self-esteem, and I want kids to be able to be normal again and have a relatively normal life so that they can do all the normal things they should be.
Absolutely. Absolutely. Well, before we close our section, I would love to hear from each of you as we sort of end, get into summer and we're sort of turning a little bit of a corner on this. What is giving you hope as we look forward?
What's giving me hope is I'm looking at the number of patients being admitted with COVID, and I now can count at all the Henry Ford hospitals on two hands. I don't even need two hands. Today, I could just use one hand. We're not seeing all these inpatients. The vaccines are working. The employees who have been vaccinated, have some of them tested positive? Yes, but they had very, very, very mild disease. None of them had to come into the hospital. So there's plenty of proof that the vaccines are working. And I think I've said at work, I've not been this optimistic about COVID in 18 months. So I'm really starting to smile more.
Oh, it's great to hear. Dr. Nava?
Sure, I think I agree. We're not seeing patients admitted, adult patients admitted and are sick and dying of COVID any longer in the hospital. I think that this race to the 70%, I think we're going to get there. That's what's giving me hope. And when I look at the numbers in Michigan, we're going to get there. There are several states that have already gotten there, and I think that we are on our way. And I think once the youngins get approved for the vaccine, we'll certainly see those numbers rise. And so I think that certainly gives me hope for at least the fall and winter months.
You know, we've heard about return to work from a variety of different sources. What does that, in your mind, look like for Detroit?
So for Detroiters, it's likely there's going to be those who've been working from home, a bit of a hybrid model. And the employer does have the right to ask for your proof of vaccination, because they want to make sure that if you're not vaccinated, it's totally your choice, but you need to protect yourself and protect others around you. So there's going to be guidance on proving your vaccination status and then also wearing a mask. Even if you are fully vaccinated, also, they still may require you to wear a mask from your employer. So they do have jurisdiction on the control of mask wearing. It's going to be a process where we at the City of Detroit have the ability to consult with businesses if they have questions too. We can always connect the community with the environmental health to make sure that it's hopefully stressless and organized to get back to work.
Returning to work, a lot of employers are doing somewhat of a hybrid model. So I'm seeing a lot of slow transition and respecting of those that don't want to get the vaccine and those that are believers of getting the vaccine. And I'm probably one of those ones that have not pushed anyone to get the vaccine. But I think that's just mainly because of my HR background and being careful about and sensitive to those that have some concerns around obtaining the vaccine. A lot of employers, especially the smaller ones, might be somewhat out of compliance, but there are guidelines out there that should direct the employers into how to create a safe place or work environment for employees to feel comfortable in coming back to work. There are some OSHA regulations that they have to provide a safe and comfortable environment for those employees to return back to work. The answer of can an employer mandate a vaccine is yes, but like the legal, it kind of depends on different situations. There's reasonable accommodations, and if you're someone that has a disability or religious belief that is not in line with obtaining the vaccination, then you need to talk to your employer about that. There's going to be situations and that not all employees are comfortable, and employers need to be sensitive surrounding that and be careful about how they're asking questions.
You said something that was interesting. Yeah, so certainly being sensitive. If I could just go back a little bit, because we know that this is both a health issue, but it's also liabilities, it's workforce. You mentioned that there might be some employers that are out of compliance. So could you talk a little bit about, if I am an employee and I'm returning to work, what are the things that the employee should be looking for in terms of safety in that workplace environment?
Sure, great question. And it's typically a lot of small business employers because they're not aware, of everything that they need to have with them at the time. But I would be asking for some type of plan. What's your plan for having people return back to work? You can ask questions surrounding like what things are they putting in place, such as, are there signs up telling employees to continue to get their hands washed, keep social distancing in place, 6 feet from each other, and if not, wearing a mask when you're closer. HVAC questions. So making sure that there's a clean airflow going through the building. And that's stuff that your HR manager should know, or some of the owners should know and be aware of. What are the disinfecting practices within the workplace? What's going on? A lot of these things aren't just written down. And so that's kind of where they could be out of compliance. And so having that stuff written down and, being able to give that to the employee when there is questions can kind of ease some of the nerves when returning back to work.
About that. And where do you recommend that employers of any level, because as you well know, many small businesses, as well for that matter, many nonprofits don't have the opportunity to be able to hire HR. So, you've got executive directors and managers who are doing that important work literally off the side of their desk as well. Where do folks go right now, do you recommend, to be able to develop those return to work policies and some of those best practices that can also be obviously shared with boards of directors and also shared with employees? Where do employers go?
There's so much guidance out there right now, but I think where I would recommend for any employer, small business employers in Michigan to go to is the Michigan, it's called the Michigan Department of Labor and Economic Opportunity.
Okay.
And they'll be able.
Yeah, as you said, there is quite a bit. Do you have any guidance to employers? So let's say people are coming back into our various offices, and not everyone is vaccinated. So you've got a mixed group, people who are vaccinated, some people who are not. What are the requirements, and what are some of the conversations should be happening around the issue of exposure and how to contain that? Any recommendations?
There's not really any type of requirements around. I mean, if you're in a healthcare setting and you're working with a lot of individuals that are maybe have their health compromised, there might be a requirement in that situation. So like a hospital setting. But most employers, even though they legally can require it, they don't have to. I mean, there's steps that they have to go through. So they have to go through like a, undue hardship risk evaluation. And then they also want to consider, the disability and the religious components that fall underneath it.
What's your sense of how many employers are looking at a return to work, even though you said it'll be probably some kind of hybrid format? What have you seen in the literature and as you talk about your various customers?
I've seen a lot. It varies widely. So some of the customers have, basically given up their office and they're planning to go completely remote and cut that cost out. And others are doing more of a hybrid model where they're, bringing employees back into the workplace, but just slowly. So it's kind of a split situation. I know some employers are very anxious in getting their staff back into the workplace just to have that camaraderie and just the collaboration. But there's so many tools out there now that employers can use to collaborate with one another and that they've kind of been forced to throughout this year. And so now it's kind of a common tool that most employers will use.
What are the requirements, if any, for employers to provide to the community or to employees about the number of infections that have occurred in that setting, or even for that matter, what percentage of personnel are vaccinated? Are there any requirements around that?
So there is a OSHA requirement that you have to indicate if there's any fatalities surrounding that. An illness was occurred within the workplace, and that comes out every April of every year, and it's posted for about 30 days. Other than that, there's not much other data that I can think of off the top of my head that would be required. I don't think that employers are required to say, hey, this percentage of the workplace is been vaccinated.
Every week, we are bringing you information and knowledge to enable you to make good and healthy decisions for yourself and your children and your family and Detroit. And so speaking of staying safe and what we need to do as we are dealing continually with the reality of COVID, and now we know we have the opportunity with vaccines, multiple vaccines, and yet we still have many questions that exist in our community. And we also have people who are getting answers and telling their story about why they have chosen to become vaccinated. Well, we're really excited today because, as we always try to do, is we try to bring in voices from the state as well as local to share with us how we are addressing and overcoming the factors that have just literally devastated our nation, and particularly Black and Brown and poorer communities throughout Michigan. So to help us think about this, we're really pleased. Some of you have even seen it, which is the What's Your Why campaign. As we all know, Michigan is blessed with phenomenal leadership, and through our executive office and our Michigan Department of Health and Human Services, they have wisely chosen a marketing firm that has been doing a pretty outstanding job of just really bringing us images of people and stories about how they've made that decision to get vaccinated. And it's called the What's Your Why campaign. I am really delighted to welcome with us, Celeste Miller is with us, and I just ask you to wave there. We see you, and we're happy to have you represent Brogan and Partners. Can you tell us a little bit about the campaign first, and then we'd love to hear a little bit about your story too. Go ahead, Celeste, and welcome.
Hi, thank you so much. Of course. So yes, as part of MDHHS, we did a couple commercials on my why, very, very touching stories. Some had stories of their parents getting sick or them not seeing their parents for a year. Some even had really close family members and friends pass away from COVID. And they were all really, really touching to hear those people's stories. The campaign has done so wonderful. And if you go to MDHHS's site, you can see all of those videos on there. And my story was actually part of one of them. So I'll tell you a little bit more about that. I am now 30 weeks pregnant and fully vaccinated. Around the time I did my commercial, I was 22 weeks pregnant. And actually, we were pretty dead set, my husband and I, that I was not going to get the vaccine. We were really hesitant. It was kind of a scary topic for us, of course, because this is our first child. So we had no idea what the vaccine was going to be like for pregnant women. And one Friday, I was pretty overwhelmed because there was a story of somebody that I know who had gotten pretty sick with COVID while pregnant. And it kind of hit home because I then realized I didn't know what the side effects really were of getting COVID. I was more scared of getting the shot than I knew what would happen to me if I actually had COVID while pregnant. So we actually reached out to multiple OBGYNs, a lot of doctors, but the one person who actually made our decision easier was a board certified infectious disease expert from Henry Ford, who I know personally. I reached out to her. We talked about the pros and the cons of getting the vaccine, but then she also let me know all of the side effects and what might happen if I actually had COVID while pregnant. And I left that conversation so grateful for her because I knew 100% that I wanted to get vaccinated. So that following day, on Saturday, I was really actually lucky enough to get vaccinated. It only took a day to get in. I had absolutely no side effects, which was wonderful. And I was so relieved that I was able to get vaccinated. And then a part of the story that I actually haven't been able to share with anybody is that my husband actually had to go on a work trip. We each had one shot, and he was exposed for 7 days to somebody who was totally asymptomatic. We had no idea he had COVID.
Goodness.
Yeah. And so then he had come home and he actually exposed me for probably 3 days, and we had no idea. So we were pretty sure that I was going to get COVID because we only had one shot at the time. My husband had got it and I actually did not get it. I was so lucky. And I was scared because I was like, oh no, I'm not fully vaccinated yet. But I actually built enough antibodies that I didn't get COVID. And obviously we have to stress how important it is to get 2 doses of the vaccine, because obviously my husband is one of those cases where he still got it. But I was lucky enough that I didn't get sick. I was totally fine. And then I was able to get my second shot still with 0 side effects again, totally protected. And so we knew that we made the best decision for us as a family, because if I didn't get vaccinated, who knows what would have happened.
That's a powerful story. And so your why has so many different elements to it. I would just love to pull back for a minute. So when I think about the campaign that we've been seeing, at first the state was giving us facts and information, and we were really emphasizing the science, because we know the science proves that the vaccinations are safe and they are effective. And you just gave testimony also that as a pregnant woman, once a scientist, a physician explained all that detail to you about what could happen with pregnancy without the vaccination, you really made a decision that was ultimately the best for you.
Yes.
And that's really important. And that's what we're trying to let people know. Get the information, talk to a trusted source. In your case, it was wonderful. You had a friend who was a physician, and of all things, they have that level of detail. So we're really pleased that we've been seeing now this host of images, not only of people like yourself, Celeste, but everyday folks talking about why they made that decision. But rather than me talking about it, why don't we do this? Molly, want to double check with you. We would love, if possible, might we be able to see the video clip of Celeste telling her story?
Can I ask you a question? Why did you get vaccinated?
I got vaccinated because I am 24 weeks pregnant and we wanted to protect our baby boy. I started hearing stories of people getting COVID and having to give birth alone. Once we talked to my OB, we talked to multiple MDs, and they decided that the best way to protect me and baby was to get vaccinated. We cannot wait for you to come and see all of your family where everyone's safe and vaccinated and COVID-free.
Wow. So how do you feel? I'm just kind of curious now. When you look at yourself, and now you know that you're all over YouTube and you're on regular channels, what is it that you're hoping that people are feeling or thinking as they hear you share your story?
Yeah, so when I was reached out to share this, I was really overwhelmed because I had no idea that this would be a story that I'm even sharing. But, you know, I hope that other pregnant moms like me, or even new and breastfeeding moms, can really see this and know that it's okay to be scared of getting it. It's okay to be curious, because the only thing that we're doing, right, is trying to protect our child. It's our main priority now until the rest of our lives. So I hope that they see this and they reach out to their doctors, get that information, and then make the best decision for them and their family, essentially.
Yeah, that's awesome. And you really proved the point that why our coalition even in fact exists. We exist to help lift up information from trusted sources and say and share and love on our community with facts so we can make good decisions. But let's kind of move forward, because not only is the campaign talking to people like you, and if I believe your ethnicity is what? Would you like to share that, please?
Yeah, yes, of course. I am Hispanic. So that was another reason. There was some data and some facts that Hispanic people are getting hit kind of harder. And that also made me nervous, knowing that that was my background. So that was definitely one of our deciding factors. I wanted to make sure I was protected, as well as my whole family.
Yeah, because we know, unfortunately, the reality is that COVID has most adversely and disproportionately devastated Black and Brown and Native American communities more so. And even now, while people are thinking somehow that COVID has gone away, we're beginning to see an uptick in hospitalizations, and hospitalizations unfortunately can lead to more deaths, both of Black and brown citizens. So we need people to pay attention. But we've got some more stories, and we're hoping that folks can think about that. So we have another story of someone who has been in a vaccine clinic in the city of Detroit. Molly, can we see that story, please? And that should be our number 2. Yeah, go ahead.
Can I ask you a question? Why did you get vaccinated?
Try to get back to some type of normal life.
Tired of being cooped up.
I love to travel and I'm ready to get back to it. I like to get back to my grandmother's hugs.
I really like being around people.
It's not the same doing it virtually. We miss the touch and then dancing together and laughing together and singing together.
Why did you get vaccinated?
It gives us hope.
Oh, the shot is giving me a peace of mind.
Hey, Granny, I'm coming to hug you one day soon.
I love that. I think Detroiters, Flint, wherever you are, Bloomfield, you can see and relate to all that. Hug each other. There's nothing like, by the way, now that I'm vaccinated, there's nothing like walking up to other people that you haven't been able to hug for a year or more and to be able to hug them. I do believe while we're talking about hugs, some of the people that we most love to hug are our kids. So now we know that vaccinations are available, and not only just available, but they have proven to be effective. And that is so important now that we know that we have more different variants that are out there. So let's hear from a child really quickly that has been vaccinated in that 12 to 15-year-old group. And then Celeste will get ready to transition. Molly, can you play that last one for us, please?
Can I ask you a question? Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
I want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know.
The boys lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
And we saw one of our foremost physician advocates, Mona Atisha, as a pediatrician, letting us know, families, that this is so important for our children. Let's try to make sure that we don't have any more losses. We are here to be informed and to be powerful. Celeste, thank you so much. And audience, we're asking you to help tell your story. Send us a photo, send us a video. Next week, the COVID Coalition is going to support this campaign by making videos of our why. And we invite you to do the same thing. All of this has created for us new opportunities to think and move our children forward. And yet, COVID is still here. But it's important, parents, as you think about COVID, we want you to meet one of the parents that we think has been awesome. And not only thinking about COVID, but in her own experience, how can she keep herself safe and how can she help keep her children safe? So I'd like to ask Kasham Houston, if you would come on screen with us, please. Hi, Kasham. So I've just kind of given you a little bit of a thing. Share with us what has moved you about COVID and the decisions that you've made, particularly about the vaccine for yourself and also your family?
So what moved me? Well, let me give you a little bit of background. I am a social worker and I work in an adolescent clinic for youth who are already immunocompromised. And so we were definitely concerned with the impact of COVID on those individuals that I have been taking care of. So let me tell you a short story. When we realized the impact of COVID initially, and everyone was sent home. As a social worker in a clinic, I was sent home for 2 weeks and I was right back in the clinic. We were right back seeing patients. In the process of me seeing patients myself, both of my adult daughters work in healthcare. I had a daughter in a nursing home that was actively working. I had another daughter in a hospital that was assigned to a COVID unit. I had a 1-year-old granddaughter and a 15-year-old son. And every day, to some degree or another, we were all exposed either directly or indirectly from each other to COVID. You can't imagine the mental toll, or maybe some of you can actually imagine the mental toll that takes, and physical toll that takes, coming in your back door, literally taking off all of your clothes, putting them in a garbage bag to put them in the washing machine. And this was literally a 7-day cycle. So when we were allowed the opportunity to be vaccinated, it was really not a question in my home. As a healthcare worker, I've been vaccinated since the very first round of vaccines were available. Following my daughters, my husband, and then just recently my son, who just turned 16 on April the 20th, like 2 weeks after the vaccine became available to that age group. Why was it important? So I've heard everyone, and I'm so excited to be celebrating Juneteenth with you all, but we're at a pivotal time, right? So as we're celebrating freedom, we still have a lot of challenges to face regarding equality. And we would be remiss not to acknowledge that people of color, African Americans, still have an exorbitant amount of health disparities that plague us in Detroit, right? And there is a lot of apprehension in the African American community regarding vaccinations. So using my voice and my platform in healthcare, I took that as an opportunity to be the example, and for my family in total to be that example. It's challenging to be in a healthcare setting and advising other people to do something that you are not willing to do. And so I wanted to be able to proudly say that my family has been vaccinated. I wanted, when I'm talking to a 16-year-old and they're asking, do I know any young people that have been vaccinated? I can say my son was vaccinated. He was vaccinated, and it was so interesting that it wasn't something that I made him do. It was something that he wanted to do. It was something that he asked about doing. It was something that he was watching, the news to find out when it would be available and inquiring. Of course, he had questions. He's 16,
Right, exactly.
He's 16. Of course, he had questions.
So first off, thank you so much for sharing your personal story. I think people in some ways, because of the trauma of this time and the sunshine outside and how much we all want to get going, it's so easy, isn't it, for us to forget that reality. And so I'm also wondering if you don't mind, we're speaking of your son, Richard. So I had the joy of, you and I are connected through a lot of different places together, but also one of them is the work with Wayne Health, the mobile unit. And there was the wonderful health fair just a couple Saturdays ago in which I met your son. And so I would just love to be able to share, if I get a chance, if someone can connect me to be able to do a screen share, I would love to share a picture of Richard. But you guys can let me know. Can I do a screen share? Here we go. Perfect. Cool. So we'd love the audience to be able to see who is this wonderful young man, Richard Houston. And I have to share with you one of the things, Kashan, that he said, or maybe I'll ask you, do you recall or could you share why Richard himself said he wanted to be vaccinated?
Absolutely. He wanted to do his part in ensuring that COVID is eradicated in his community. He's very proud and he is very responsible. And so he said, it's my responsibility to do my part. And he looked at it as, one part to the total picture. If I do my part and encourage other people, my peers, to do their part, then we will be that much closer to, removing COVID from our community and decreasing the prevalence rates. So he felt like it was his responsibility, which was so amazing to me to understand that, he gets it. He gets that we all have a level of accountability for our actions, for our responsibility, and for our community. We're responsible for our community.
So, Kisham, thank you for sharing your story. Thank you for lifting up to remind us that it's not only a personal story, it's not only a personal decision, but a sense of collective responsibility, that collectively, by taking the vaccine, no different than people have internationally in decades past, whether it's to take the polio vaccine, measles, diphtheria, all of these horrible diseases that have affected the human race, we now can step up and say, I can take this vaccine because, like Richard, it's my personal responsibility to care and love on my community. Keishan, thank you for having a wonderful son, raising him like that, and blessings to you and all of your family. We'll see you out there. Continue to stop COVID. Thank you. Thanks so much.
With that, I will ask all of my co-planners and everyone who joined us to please turn on your camera so we can all say goodbye together. Wishing you all well, stay powerful, stay informed, and we will see you back live in a couple of weeks. Thank you, everyone.